Hello everyone, Dr. Mike here. Today I'm going to share something that could literally save your life or the life of someone you love. I've been noticing a frightening pattern among my patients over 60. They come to my office with similar complaints. Dr. Mike, I don't have the strength to lift even a grocery bag. My legs shake when climbing stairs. I've fallen 3 times this month. What many don't know is that there's a silent nutrient being stolen from their bodies. And the older you are, the more vulnerable you are to this dangerous deficiency. What I'm about to reveal might seem simple, but believe me, it's transforming the lives of elderly people who previously could barely walk and are now regaining their independence. Stay until the end because I'll share exactly how you can reverse this process and recover your muscle strength. Did you know that 70% of seniors suffer from a deficiency of this essential vitamin without even knowing it? And most alarming, studies show that this deficiency increases the risk of fatal falls by 78% in people over 65. I'm talking about vitamin D, but not just as that sunshine vitamin that everyone mentions superficially. What I'm going to explain today goes far beyond that. The hidden connection between weak muscles and vitamin D. Let me tell you about Martha, my 73-year-old patient. When I first met her, she could barely get up from a chair without help. "Dr. Mike, I feel like my body is betraying me," she said with tears in her eyes. Tests revealed a vitamin D level of just 12 nanograms per milliliter, well below the healthy minimum of 30 nanograms per milliliter. After 3 months following the protocol I'll share today, Martha not only regained her mobility but returned to dancing, her passion that she had abandoned years ago. Most doctors don't tell you this, but vitamin D isn't just an ordinary vitamin, it acts as a potent hormone in the body. When levels are adequate, it activates specific receptors in muscle cells that are essential for 1. Muscle protein synthesis. 2. Efficient muscle contraction. 3. Physical strength and endurance. 4. Muscle recovery after exertion. A Harvard University study followed 4,100 seniors for 5 years and discovered that those with severe vitamin D deficiency lost, on average, 32% of their muscle mass, nearly 1/3, compared to just 8% in those with adequate levels. And here's what I consider the most alarming fact. Researchers from the University of Tokyo demonstrated that elderly people with severe vitamin D deficiency have a 270% higher risk of developing sarcopenia, the progressive and generalized loss of muscle mass that leads to frailty, falls, and in many cases, total loss of independence. Why seniors are especially vulnerable. There are 4 fundamental reasons why your body might be robbed of this essential vitamin as you age. First, your skin produces 75% less vitamin D at age 70 compared to age 20. It's as if your internal factory is operating at minimum capacity. Second, your kidneys, responsible for activating vitamin D, lose efficiency with age, converting up to 50% less vitamin to the form usable by the body. Third, many medications common among seniors, such as anticonvulsants, corticosteroids, and certain blood pressure medications, interfere with vitamin D absorption and metabolism. Fourth, reduced mobility means less sun exposure, creating a vicious cycle. Less strength leads to fewer outdoor activities, resulting in less vitamin D, which in turn further decreases strength. Signs your body is crying for help. Before continuing, I want to ask a favor. If this content is helpful to you or could help someone you know, please leave a like and subscribe to the channel. I share information like this every week, always based on serious scientific research, to help you live longer and better. Now, let's continue. How do you know if you or your family member is suffering from this silent deficiency? Look for these signs. An unexplained muscle weakness, especially in the legs, a difficulty getting up from chairs or bed, a constant muscle pain without apparent cause, a frequent imbalance or feeling of instability, a recurrent falls or near falls, persistent fatigue that doesn't improve with rest. Patient Regina, 68, came to my office after fracturing her hip in a fall. "Dr. Mike, I've always been cautious and careful," she said. "I don't understand how this happened. Her tests showed vitamin D levels of just 14 nanograms per milliliter. What makes this case even more moving is that Regina watched her diet and religiously took her calcium supplements to prevent osteoporosis, but no one had ever checked her vitamin D levels. A simple test could have prevented months of painful recovery and the permanent loss of 30% of her mobility. The science behind the muscle vitamin D connection. Let's understand exactly how this deficiency affects your muscles at the cellular level. Vitamin D binds to specific receptors in muscle cells called VDRs, vitamin D receptors. When activated, these receptors trigger a cascade of events that keep your muscle fibers strong and functional. A study published in the Journal of Clinical Endocrinology e-Metabolism demonstrated that the density of these receptors decreases dramatically with age, up to 50% less at age 80 compared to age 30. When vitamin D is at adequate levels, it increases calcium uptake in muscle cells, essential for efficient muscle contraction, activates genes responsible for muscle fiber growth and recovery, reduces chronic inflammation that degrades muscle tissue, improves neural signaling to muscles, enhancing coordination and balance. Researchers at the University of Zurich demonstrated that elderly patients with adequate vitamin D levels have 37% faster reaction times, crucial for preventing falls when tripping or slipping. Beyond muscles, why this deficiency can be fatal. Muscle loss is just the tip of the iceberg. Vitamin D deficiency is directly linked to a series of potentially fatal conditions. 1. Falls and fractures, the leading cause of accidental death in the elderly. With weak muscles and compromised balance, the risk of falling increases dramatically. A study with 1,200 seniors showed that adequate vitamin D supplementation reduced the risk of falls by 72%. 2. Progressive frailty, a medical condition characterized by exhaustion, weakness, and reduced physical activity that increases vulnerability to diseases. Research from Johns Hopkins School of Medicine demonstrated that elderly people with severe vitamin D deficiency are 3.5 times more likely to develop frailty syndrome. 3. Severe respiratory infections. Vitamin D is crucial for the immune system. A large British study with 11,000 participants showed that seniors with severe deficiency had 2.5 times higher risk of severe pneumonia. 4. Cardiovascular diseases. Vitamin D regulates blood pressure and reduces vascular inflammation. The Framingham Heart Study, one of the most respected studies on heart health, documented an 80% increase in the risk of cardiac events in elderly people with this vitamin deficiency. Dr. Mike's Protocol: How to recover your muscles and your life. Now, let's get to what really matters: how to reverse this situation. My protocol is based on scientific research and experience with hundreds of elderly patients who regain strength and independence. Step 1. Know your numbers. Before anything else, ask your doctor for a 25-hydroxyvitamin D serum test. This is the only reliable test to assess your levels. Unlike other tests, it's not enough to think you're fine. Vitamin D deficiency is silent and rarely presents obvious symptoms until it's at an advanced stage. The ideal is to maintain levels between 40 to 60 nanograms per milliliter for optimal muscle health. Below 30 nanograms per milliliter is considered deficiency, and below 20 nanograms per milliliter is severe deficiency. Step 2. Smart supplementation. If deficiency is confirmed, supplementation is essential. But pay attention. It's not simply taking any supplement anyway. For seniors over 65 with confirmed deficiency, I recommend, always with medical supervision. The correction phase: 5,000 to 10,000 IU daily of vitamin D3 for 8 to 12 weeks. Maintenance phase: 2,000 to 4,000 IU daily after normalization of levels. Vitamin D3, cholecalciferol, is the preferable form as it's more effective in raising blood levels compared to D2, ergocalciferol. Crucial: vitamin D is fat-soluble, so it should be taken with a meal containing some healthy fat to maximize absorption. A University of Cleveland study demonstrated that taking it with healthy fats increases absorption by up to 32%. Step 3. essential partnership with magnesium. This is information that few doctors share. Vitamin D doesn't work properly without sufficient magnesium. Magnesium is necessary to convert vitamin D into its active form. Research from Arizona State University showed that people with adequate magnesium levels need 30% less vitamin D to achieve the same blood levels. For seniors, I recommend a 300 to 400 milligrams of magnesium daily. Prefer forms such as glycinate, malate, or citrate, which are better absorbed. Consumption of magnesium-rich foods such as dark green leaves, almonds, avocado, and pumpkin seeds. Step 4. The safe sun strategy. Yes, sun exposure is important, but it must be done intelligently, especially for more sensitive elderly skin. The recommendation based on studies from the University of Sydney. 15 to 20 minutes of direct sun exposure on arms and legs, without sunscreen, between 10 a.m. and 3 p.m., 2 to 3 times a week, for darker skin. A longer exposure time may be necessary. Avoid burns. Vitamin D production occurs before the skin turns red. A moderate walk outdoors kills 2 birds with 1 stone. It exercises the muscles while producing vitamin D. Step 5. Nutritional enhancers. Certain nutrients work in synergy with vitamin D for muscle health. A vitamin K2 directs calcium to bones and teeth, preventing arterial calcification. Sources include fermented cheeses, egg yolks, and natto, fermented soybean. Omega-3 reduces muscle inflammation and improves insulin sensitivity, important for muscle metabolism. Sources include fatty fish such as salmon, sardines, and mackerel. Adequate protein, essential for muscle maintenance and recovery. Seniors need approximately 1.0-1.2 g per kg of body weight daily, distributed throughout the day. Transformation stories. Reversal is possible. Many of my patients didn't believe they could regain strength and independence. Let me share some inspiring stories. Carlos, 77, a former mechanic, had given up his daily walks due to constant muscle pain and weakness in his legs. His tests showed vitamin D levels of just 9 nanograms per milliliter, extremely low. After following the protocol for 4 months, his levels rose to 52 nanograms per milliliter. The result? He returned to walking 3 kilometers daily and resumed his passion for woodworking, which requires considerable hand strength. Helen, 82, a retired teacher, suffered 3 falls in 1 year, resulting in a wrist fracture. Her tests showed severe vitamin D deficiency, 11 nanograms per milliliter. After 6 months following the protocol, along with specific balance exercises, she not only had no more falls but returned to dancing with her husband at family parties, something she had abandoned for fear of falling. What impresses me is the speed with which many patients begin to notice a difference. Approximately 67% report noticeable improvement in strength and energy after 8 to 12 weeks following the complete protocol. Specific exercises to enhance results. While your vitamin D levels are being normalized, certain exercises can significantly accelerate muscle recovery. 1. Progressive resistance exercises. Start with light weights or just body weight and gradually increase. Research from Boston University demonstrated that this type of training combined with adequate vitamin D levels results in 39% greater strength gains in seniors, compared to exercises without correction of the deficiency. 2. Balance training. Standing on one leg, with safe support nearby, walking in a straight line, and simple Tai Chi exercises improve the connection between brain and muscles. 3. Functional movements. Practicing the movement of sitting and standing from a chair without using hands, climbing steps, and carrying small weights during walks helps strengthen essential muscles for daily activities. Pitfalls to avoid. There are some common misconceptions that can compromise your recovery. 1. More is better. Unlike many vitamins, excess vitamin D can be toxic. Never exceed 10,000 IU daily without medical supervision and regular monitoring. 2. Ignoring comorbidities. Certain conditions such as kidney disease, hyperparathyroidism, and sarcoidosis require caution in supplementation. Always inform your doctor about your existing conditions. 3. Expecting immediate results. Muscle recovery is a gradual process that takes time. Be patient and consistent. 4. Focusing only on vitamin D, a holistic approach that includes adequate nutrition, hydration, quality sleep, and appropriate exercises produces superior results. A final appeal: don't ignore this sign. If you've made it this far, congratulations for investing in your health or that of someone you love. Knowledge only has value when transformed into action. I see the devastating consequences of vitamin D deficiency in seniors daily, and the saddest thing is that many cases could have been prevented with a simple test and proper correction. As a health professional, few moments are as rewarding as seeing patients like Martha, Carlos, and Helen regaining their independence and quality of life. If you like this information and want more content that can literally transform your health, don't forget to leave your like, subscribe to the channel, and share with those who need this information. Ask a question in the comments. Have you checked your vitamin D levels in the last 12 months? Your answer might inspire others to do the same. Remember, knowledge is power, but only applied knowledge is transformation. Don't let the lack of a simple vitamin rob you of your strength, independence, and potentially your life. It is also very important to point out that all the information in this video was taken from research and studies. It is very important to consult your doctor before starting, continuing, or stopping a medication. Until the next video, Dr. Mike, always committed to your health and longevity.